Joining us this morning with, we hope, fewer audio problems, the Transport Secretary, Grant Shapps. Mr Shapps, good to see you this morning.
Morning.
Somewhat appropriate that we come off the back of the GDP figures and a week of big announcements, yours yesterday, certainly one that people are hoping will give a shot in the arm to the economy. Just take us through the thinking behind that which you announced yesterday, particularly as regards the lack of requirement for people coming back double vaccinated from amber list countries to isolate.
Yeah, well, that's right. I mean, up until now, if you've gone to an amber list country, well, for a start, we said you shouldn't be going there for holidays, but you also had to come back and you had to quarantine or self-isolate. What we did yesterday, on the basis of the fact that we now have such a large proportion of people fully vaccinated, it said if you have been fully vaccinated, then you can essentially travel from the 19th of July to an amber list country without needing to come back and quarantine. You'll still need to come back and take a day 2 PCR test, but that will, of course, open up a large number of countries which fall into that amber category, by far the biggest group between the red, amber and green. So good news for people who are looking forward to maybe seeing loved ones abroad or even catching some sun.
But what, though, of loved ones who live abroad and come back here? As you say, you're talking about people who are fully vaccinated, but fully vaccinated via the NHS. I think at the moment there are around about 30 countries that accept our certification. Why won't we accept anyone else's?
Well, that would be phase 2 of it, and something we're very actively working on at the moment. Of course, with the UK vaccination programme, you're able to demonstrate your vaccine status very easily. The full NHS app, that's not the COVID app, I should point out, it's the regular NHS app, contains your record for your vaccines. So once you've been fully vaccinated, it effectively gives you a certificate which you can show on screen or download. So it's easy for us to be able to use that in order to demonstrate the status for somebody returning home. That's the first stage. The next thing is to be able to recognise apps from other countries or certification from other countries, easier done from some places like the EU, where they have a digital app coming along, than it is in the United States, where they have, I think, 50 different systems, one for each state, largely paper-based. So there's some complexities to work through there. But this is phase 1, and we hope to follow it up quickly with double vaccinated people from other countries coming here.
Can you put some sort of time frame on that? Because clearly a lot of people are looking forward to your announcement yesterday. They may well have some time off coming in the summer. There are an awful lot of expat Brits wanting to come back to the United Kingdom to see their family. Do you think you're going to be able to have this done, next couple of weeks, next couple of months, by the end of the summer?
Yeah, so, I mean, first of all, this announcement kicks in from the 19th of July for anyone who's been vaccinated in the UK. And then secondly, we're actively working on this issue of how to accept vaccinations from other people. Obviously, we'll look at whether they are World Health Organization certified and the like. I would think in terms of timescale, in the next couple of weeks, I'll be able to come forward and say more about other locations in the world.
Do you understand, though, the frustration of expatriate Brits? For example, living in Italy this weekend, we're going to see around about 1,000 Italian fans coming to this country to watch the football and then heading straight back home afterwards. There will be thousands of people looking at that and saying, well, why can't we do the same? People who perhaps haven't seen their families for the best part of a year and a half.
Yeah, no, I mean, look, we want to be able to open that up for people and actively working on it. I should say with the football, they come to a specific location, they're taken direct to the football, they leave again 12 hours later. They're unable to travel anywhere else, etc. It's a very restricted program. But nonetheless, I'm going to take the point. I think we do want to get this done. Part of the issue, of course, is elsewhere, the level of fully vaccinated people tends not to be at the levels that we've got in the UK because we got on with our vaccination program so much faster. So, there aren't as many fully vaccinated people, for example, from Europe to come here. But nonetheless, we are working on it. We do want to get this part of it resolved as well. I thought it was important with this phase 1 section, people who've been vaccinated in the UK, to get that information out there as soon as we were ready to make the announcement, which is why I did that yesterday. But I said we'll follow up with phase 2 for people coming the other way as soon as we can.
Just explain as well, if you can, Minister, the rationale for asking for a PCR test from children as young as 5, 6 years of age.
Yeah, so first of all, I should point out that children, 18-year-olds and under 18, of course, children, will be able to follow the same rules regardless of whether they've been double vaccinated. And of course, the answer is they won't have been double vaccinated because currently the Joint Committee on Vaccines and Immunisation have not recommended yet vaccinating children. We're waiting for them to opine on it. So we thought it was right and proper, because they can't be vaccinated, to allow them to adhere to the same rules. But we must, of course, make sure that we've got protection for everybody in the United Kingdom in place, and a PCR test remains the best way to do that. And it does mean that we're able to then keep a very close eye on those variants of concern, which are, of course, the thing that we are most worried about now. We don't want to put the country at risk, and that could be carried by a child as well. So that's the reason why we're doing it, and it's the reason why everybody will still have to take a PCR test on day 2 when they return.
Indeed. You mentioned a couple of minutes ago the NHS COVID-19 app, and I'm presuming actually will have had conversations about this with people in your own department about the concerns that when we get into the summer and we see, as the Health Secretary outlined, cases perhaps running as high as 100,000 new cases a day, perhaps even higher than that, that we are going to be in a position where we are seeing potentially millions of people, and certainly not the majority of them with COVID-19, but millions of people being forced to self-isolate. What action is being taken on the app at the moment?
Yeah, that's right. I take advice on this, or we take advice on this from the medical experts. And as things like the overall nationwide levels for things like the amount of distance that you need to keep, the social distancing, and other rules are looked at, so will we look at the way that the app performs with regard to what are now the new standards being in place. So we always keep a very close eye on those sort of things. I did speak to the Health Secretary about it yesterday. He's very aware of this, and we'll keep it under constant review, because we want the app to be a useful tool in our armoury to make sure that we're all able to be aware of and ultimately defeat the coronavirus, and we want it to continue to work in that way.
Yeah, so sorry to interrupt, Minister. We're just a bit pushed for time, but people are deleting the app as we speak. People are switching off the contact tracing aspect of it. It is fine that there will be some tinkering. We're told that it will be less sensitive in future. But if people have deleted it from their phone, they're unlikely to be putting it back on. It just feels like we might have missed the boat on this one.
That's not actually the evidence, by the way. We're still seeing lots of people downloading the app. We encourage people to do so. As I say, we'll keep the sensitivity of it under review to align with the new recommendations that come in, guidelines that come in on the 19th of July. So we'll continue to do that. It is a very useful tool in the armoury, and no one wants to get long COVID. No one wants to get COVID and pass it on to somebody who becomes seriously ill or worse, dies. So it's in all our interest to carry on using every tool that we've got to defeat coronavirus. And the app will remain an important part of our armoury to do that. And we encourage people to carry on using it in the same way as we encourage people to keep applying common sense, all the things we know about, better outside than indoors and all the rest of it. And the app's another part of that armoury.
I do want to finish off our discussion this morning, if I can, Transport Secretary, on your brief and about public transport. Over the past couple of days, you will have seen a number of groups that are interested, perhaps representing those who are immunosuppressed, representing people who were in the vulnerable category before. The removal of the mandating of masks on public transport is petrifying vulnerable people up and down the country. What would your advice be to those that have to travel by public transport who fall into that category? Would you simply say that they should travel off-peak?
Yeah, for a start, we'll still be issuing guidelines. And as with everything to do with coronavirus, similar to the conversation we're just having, we've been living with this for a year and a half now. People know the things to do in order to try to keep themselves safe. And it's still sensible to wear a face covering if you're on a crowded piece of transport, a crowded tube, for example. But clearly, if you're on a train, perhaps a long-distance service, there's no one else in the carriage, it's not really protecting anyone. And we're able to now shift to people using their own common sense increasingly as we get through the 19th of July and asking people to do that. So I think it's right that we switch these things from the law to guidance. But nonetheless, that doesn't mean that we're not guiding people to be sensible and to think about how they can protect themselves and others. But recognising the fact that the majority of adults have now been double vaccinated, and of course reminding people to come forward for their vaccinations and their final vaccination if they've had the first one.
I can't have a government minister on the programme without at least once referencing the football coming up on Sunday. I won't ask you for a prediction for the result, but strange reports circulating this morning about people pushing perhaps for a bank holiday on Monday if England do it, perhaps allowing people to come in slightly later for work. What do you think?
Well, I wouldn't want to jinx it, I think, is what I'd say. We're all, not in my lifetime, I don't think in yours, have we been in this position. I don't want to say anything that's going to make any presumptions at all. And good luck to England on Sunday. We'll be right behind you.